I'm going to show you how you can get help with your drug costs. So stay tuned. I'm Keith Armbrecht, founder of MedSup Savings. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So please, after this video, take just a few minutes to explore our Resource Center. You'll likely find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill out your basic information and it will provide the rates for the plans that are available in your area. It would also be a really good idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help. Okay, we're now going to talk about ways to receive help in paying for Medicare health and drug benefits. So if you are limited income, you may have the need to get help to pay for your health and your drug costs. And again, this information is coming right out of the Medicare and You Guide 2015. If you don't have it, download it on my website. It's right in the Resource Center, but something you want to have with you now and in the future. Gives you all the answers you need to most questions. So what if I need help paying my Medicare prescription drug costs? If you have limited income and resources, and I'll show you what that means, you may qualify for help to pay for some health care and prescription drug costs. The program is actually called Extra Help, and it's only available in continental U.S., not available in Puerto Rico or Virgin Islands. Extra Help is a Medicare program to help people with limited income and resources pay Medicare prescription drug costs. Now, you may qualify for Extra Help if your yearly income and resources are below these limits in 2014. Single person, income less than $17,505 and resources less than $13,440. And I'll show you what resources means in just a minute also. Married person living with a spouse and no dependents, income less than $23,595 and resources less than $26,860. Now, these amounts may change in 2015. This is based off of 2014 numbers, so keep that in mind as well. If you qualify for Extra Help and join a Medicare drug plan, you will get help paying your Medicare drug plan monthly premium, your deductible, your coinsurance, and your copayments. You will have no coverage gap, so you will not have a donut hole in the middle of your drug plan. You have no late enrollment penalty, and you have the chance to switch plans at any time. Any change you make will take effect the first day of the following month, which is actually pretty good benefit. I'm not sure why they only do that here, but if you're in a drug plan that may not cover the drug you need or that you find out you need later, then it gives you the ability to change drug plans to one that does cover that. You'll automatically qualify for Extra Help if you have Medicare and meet any of these conditions. You have full Medicaid coverage. You get help from state Medicaid program paying your Part B premiums. You get Supplemental Security Income benefits. To let you know you automatically qualify for Extra Help, Medicare will mail you a purple letter. So you'll get a purple letter in the mail, ought to stick out, and that is what you should keep for your records. You don't need to apply for Extra Help if you get that letter, so they already know that you qualify for it. If you aren't already in a Medicare drug plan, you must join one to use Extra Help. So you have to be in a Medicare Part D drug plan to use Extra Help. If you don't join a Medicare drug plan, Medicare may enroll you in one so that you'll be able to use the Extra Help. If Medicare enrolls you in a plan, you will get a yellow or green letter letting you know when your coverage begins. Different plans cover different drugs, so drug coverage plans with Medicare can be significantly different. So you'll want to do a little research to make sure the drugs that you want covered are on the plan that you're going to enroll in. You can get a lot of information from Medicare about that. You can just call 1-800-MEDICARE. They're actually very helpful with drug plans. They'll take a list of what you tell them you currently have for prescriptions, and they'll match it with a plan that covers it the best as possible. If you're getting extra help, you can switch to another Medicare plan, as we discussed. If you have Medicaid and you live in certain institutions like a nursing home, or get home and community-based services, you pay nothing for your covered prescription drugs. If you do not want to join a Medicare drug plan, for example, if you are on your employer's drug plan or a union drug plan and you do not want to come off of that and you want to stay with that, then you need to notify them that you want to opt out of Medicare Part D because you have a qualified drug plan of your own. If you have an employer or union and you could join Medicare drug plan, you may lose your employer coverage. So certainly something to understand that if you have current drug plan and you join a Medicare one, it may knock you out of the one that you currently have. So if you didn't automatically qualify for extra help, you can apply. So you can visit socialsecurity.gov and apply online. You can call them right here. Any of that information may be helpful for you. Paying the right amount. Medicare gets information from your state and Social Security on the amount that they're told you should pay. It's not always the right amount. So make sure if you should be paying less than that, you need to notify them so that they can make the adjustments so that you don't pay more than you should. You can also give the information to your pharmacy and they can help you as well. So there's some ways here that can show proof of what you have or what you need, and just use that whenever you need to show someone proof of what you have. So for more information, Medicare.gov. What if I need help paying my Medicare healthcare costs? Medicare has several savings programs, are all listed here. Qualified Medicare Beneficiary Program pays for Part A and Part B. Specified low income pays Part B. Qualified individual program pays for Part B, and you have to apply each year. Qualified disabled and working individuals helps pay Part A, so forth and so on. So just make sure if you're on limited income that you know what's available to you. How do you qualify? You must have Part A. And then here we talk about the resources. Monthly income less than $1,333, resources less than $7,160 as a single, $1,790 and less than $1,075 married living together. Again, therefore 2014. So there are Medicaid programs that are also available. And then how do I qualify? Medicaid vary from state to state, so a lot of states have different items. So you kind of need to talk to your state medical assistant's office for more information. That information is right here as well. Pharmacy assistance programs, patient assistance programs. A lot of manufacturers offer programs of assistance for people with limited incomes. There's a PACE program, Supplemental Social Security Income benefits, and there are programs for people who live in U.S. territories like Puerto Rico and Virgin Islands as well. So that kind of gives you an idea on programs that are available for low income or limited income individuals. So I hope you found that information helpful. You're certainly welcome to visit my website. There are many other videos that may be helpful to you. You can actually run quotes right there for Medicare Supplement that'll show you the cost of an actual Medicare Supplement policy in your area. And anything else that we have, I hope you take advantage of it. So thanks for taking the time to watch the video, and have a great day.